Great to see you here. I'm your chair this evening, Peter McKenna, and we're going to start with the land acknowledgement. Leeds, Grenville and Lanark are located on traditional territory of Indigenous peoples dating back countless generations. We'd like to show our respect for their contributions and recognize the role of treaty making in what is now Ontario. Hundreds of years after the first treaties were signed, they are still relevant today. I'm looking at the agenda and I would like to add 7.1.4 business case summary. And with that addition, somebody with a blue sheet has the motion to approve the agenda. If you just take a brief look at it. All right, well, I'll seek a motion to approve the agenda as amended, moved by Stephen Bird, second by Robin Jones. Any further discussion? All in favor? And that's carried, thank you. Any conflict of interest after you've had a chance to look at that agenda? Being none, we have the consent agenda and there's a motion someone has.
I have here.
Would you please read that motion and then?
So it's moved by myself, seconded by Robin Jones, that the following items on consent agenda be approved as circulated. 5.1 minutes from the Board of Health regular meeting held on February 22nd, 2024. 5.2 general correspondence and 5.3 duty of care report summary.
Would anyone like any of those items pulled out for discussion or comment on them? Seeing none, I'll call all in favor of that motion. And that's carried, thank you. So for those staff here, I know you probably know right now we're going to, you'll hear in a minute, we're going to pass the motion in camera. I don't know exactly how long it will be. Could be short, medium, or long. I really do appreciate your patience. We will be back as soon as we are finished our discussion. In the meantime, Heather has arranged a buffet, an Easter buffet for everyone. And I'm really, please hang in there. I'm glad you're here and I hope you're all here when I get back or when we get back. So at this point, I'll seek a motion to go in camera. And I think
Moved, I have it here.
Okay.
Moved by Robin Jones, seconded by Tori Deschamps. The board moved into a closed session of the Board of Health due to the following. Advice that is subject to solicitor-client privilege, including communications necessary for that purpose, and a matter in respect of which a board or committee.
it's been moved and seconded that we move in camera. Is there any questions or comments on that? All in favor? And that's carried. And for the board members, we're just going to go down the hall. There's a board meeting room there. We're going to move ourselves and these folks are going to stay. So please grab your coffee or water or whatever you choose and walk this way. Most of you hung in. We're going to be, this is the Rise and Report from our in-camera. We're going to be getting right to the conversation we've just had in camera. And Dr. Lee is going to start us off with the feasibility study summary.
So the item, I'm just realizing we have a inception situation where me in several layers here. That's okay. So the item is really just a the item is just to mention that there is a feasibility study summary, and also the added item 7.1.4 is the business case study or business case summary, which will be posted and are going to be publicly available. Essentially, that feasibility study summary is a feasibility assessment undertaken by consultants regarding the components of the organization for ourselves and the two named merger partners, so Kingston, Frontenac, Lennox and Addington, as well as Hastings Prince Edwards. The considerations, as well as whether there are barriers and the degree of barriers to merging. So that's the feasibility study. And then the business case summary is there is a submission to the province if a merger is undertaken. There's a submission to the province as to how we might consider implementing it, what key considerations we would put in place in the merger progress, and as well a budget request to the province for this work. So those will be made available publicly and posted online.
And the tri-board minutes, that was just for information for our board. So for those listening on the recording or those present, those documents will be available publicly now. And I would also then, I'll just start with a few comments before we get to them. There is a motion we're going to consider tonight. It's called the intent merge. The way it's framed is it would move us, we intend, and by the way, Kingston, Frontenac, Lennox and Addington, Hastings, Prince Edward County at their board meetings last night passed the exact same motion. So we're going to consider doing that tonight. The intent is that we have the intention to do this. There's a number of steps between April 1st and summer, fall, where we would do all of the further work required, and then we would come back to the board. The board would get regular updates in the meantime. We'd come back to the board sometime later in 2024 with we've intended to do this, we've got the information, and now we're asking, is it a go or no go? So that gives us a chance to, should something untoward happen, if the board decided tonight to intend to merge, we could get off the ramp and not do it, or we could keep going. So that's what's going to happen. And I believe that Tony has the motion, the intent to merge motion, and I'm going to ask her to read it, if she would.
Okay, it was moved by Tony Circo, seconded by, that Leeds, Grenville and Lanark District Health Unit intends to merge with Kingston, Frontenac and Lennox and Addington Health Unit and Hastings and Prince Edward Counties Health Unit to create the Southeast Health Unit, subject to the following conditions. The provincial government approves the intended merger, and the Board of Health of Lanark, Leeds, Grenville, Lanark, in its sole discretion, is satisfied that this approval will enable Leeds, Grenville, Lanark, Kingston, Frontenac, Lennox and Addington, and Hastings, Prince Edward to successfully complete the intended merger. That the provincial government commits to provide the funding requested in the voluntary merger business case to support the intended merger, including transition costs and business continuity, stabilization funding in amounts sufficient to ensure program and service delivery stability while change is underway. And the Board of Health, in its sole discretion, is satisfied that the funding commitment will enable Leeds, Grenville, Lanark, Kingston, Frontenac, Lennox and Addington, and Hastings, Prince Edward to successfully complete the intended merger. That the negotiation, due diligence, consultations, and merger implementation, including development of a sustainable operational budget, up until a legal merger, do not identify any material issue that the Board of Health in its sole discretion determines will undermine its assessment of the benefits and the drawbacks of the intended merger with Kingston, Frontenac, Lennox and Addington, and Hastings, Prince Edward, such that the Board of Health no longer supports the intent to merge, and the Kingston, Frontenac, Lennox and Addington, and Hastings, Prince Edward Boards of Health both expressed their respective intent to merge with Leeds Grenville Lanark. That the Leeds Grenville Lanark MOH CEO be directed to further collaborate with Kingston Frontenac, Lennox and Addington, and Hastings Prince Edward to complete a voluntary merger business case for submission to the ministry no later than April 2nd, 2024. That the Leeds Grenville Lanark Merger Committee continue its cross-board engagement with Kingston Frontenac, Lennox and Addington, and Hastings Prince Edward, and report back regularly to the Board of Health on this matter at future meetings to enable subsequent Board of Health engagement and direction as the Board of Health may deem appropriate. Following completion of these matters, the Board of Health will meet for full report, deliberation, and decision-making regarding whether to proceed with the intended merger.
So it's been moved and seconded. Is there any questions, comments? I'll make one comment. I want to thank Robin Jones, Tony Circo, and Dr. Lee and Heather for their work the last few months in representing this corporation with the other two corporations throughout. They've been, I would say, the A team. The others were wonderful at our partners, but I was very proud to be with this group. They represented the corporation very well. I want to thank the staff of Leeds Grenville Lanark Health Unit. This is a difficult time. I understand that there's lots of questions and concerns, and it's more your future than almost anyone else's. And I have appreciated your patience and questions. I think Dr. Lee has assured me that she's tried to keep you up to date and give you as much information as she was able to. Most of the conversations we had with the tri-board were of a sensitive nature regarding legal obligations, ownership of property, human resources. And so we couldn't be as transparent at this point as we wanted to be, but they've gone very well. And I really do thank the staff for your understanding, and stay tuned. There'll be regular updates going forward, no matter what. Having said that, I'm just going to look around. I'm going to get ready to call a vote. Did you have a question?
I wanted to say that, this is a health unit that I think we're all very proud of. Having come through the pandemic, I think we all were, impressed daily and with the service that was provided to the citizens of Lanark, Leeds, and Grenville by this health unit. But I think as we've sat through budget deliberations and seeing that in order to balance our budget, that we're having to do things like delay staff at hiring and leave vacancies, in some cases for 9 months out of the year in a position that we felt was necessary. And that I think that we've heard that the ability to go into this merger and to have the funding that the province is willing to put in for 3 years at least, and we're hoping for even longer to smooth the transition in terms of what can happen, but that this is an opportunity. And I'm proud of our staff too, that they don't shy away from going forward, and this is a move going forward, I think, and amalgamating with the big unit is going to give us some opportunities for additional improvements and to have more support for our staff amongst themselves, working on a larger team. So I think in reading the reports and in hearing from our consultants, I've been convinced that this is a good move for the health unit to undertake. I'm grateful to the committee. I know that you've worked a lot of hours attending meetings, and the report was very well done, and I appreciated having all the information and the updates that we've had to date. And I just want to lend my support to the recommendation coming forward tonight.
Thank you. I will add that our partners in Kingston, Frontenac, Lennox and Addington, Hastings, Prince Edward have been first class to deal with. They've share a commitment to local services. They share a commitment to enhancing services to the rural communities. They all have very large, we all have very large rural areas as well as medium to larger municipalities. And they've been open to our suggestions. They've been cooperative. They're driven by wanting to do the best for the populations they're serving. And it's been a real pleasure to work with them. So
If I could.
yes, please.
Yeah, and so thank you to, to the committee that has done, so much work, Dr. Lee, the work that you've done getting us to where we are tonight. Certainly want to echo, the chair's comments and Fullerton's comments as well. I certainly think by leveraging the strengths of, all of the units, continuing to work together with that common goal of enhancing rural service delivery. You said rural service delivery, and it just made me think that I don't want, when there's members of public listening and seeing it, that there is a chance that our rural service delivery is going to be impacted in a negative way. I see this as potential for a positive impact. We do have fantastic folks working here, and I certainly think that there is the potential here, have very positive impact on the health and the well-being of our communities, both here in LGL and across the other two as well. So speaking in favor of.
So I'm going to call a vote. So you've heard the motion. It's been moved and seconded. All in favor of the motion. That motion's carried. Thank you very much. A very interesting evening for sure in the history of our corporation. The MOH verbal report, Dr. Lee, do you have anything short that you want to say?
I regret that my report is actually not particularly short. It does have to do with this merger item. I do have a set of slides. I'm just going to make sure that I have it correctly.
One more motion.
Oh.
And it was the submission of the business case. Which, all right, so I didn't understand it was separated. And you have it.
I have it.
Yeah. Seconded by Tony Circle. Sure, please.
This is a motion for the business case. It is moved by myself, Ruth Lockett, and seconded by Tony, that the Board of Health endorse the business case submission in the principal, which will be signed on behalf of the LGLBHU by the board chair of the Ministry of Health and CEO.
So we've moved, so this is just formally that document that needs to go in April 2nd, which gives us the authority to sign it on behalf of the board. So it's been moved and seconded. All in favor? That's carried. Thank you. Thank you, Ruth. Thank you, Heather.
Peter, I just like to echo what everyone else has said about the work the group has done, and to get us to this. And as Peter said earlier, this is the first, maybe the second step. And but I'd also like to thank them for all the work they're about to do, because this is not the end, and there's going to be a lot of work for the group to do, and a lot of decisions to be made, and so this is ongoing. It's going to be ongoing, and I'd like to thank you for all the work you have done, but especially for all the work you're going to be doing in the future. That this isn't like it's over for you people, and the information will be coming back to us, and we still have decisions to be made. But certainly we're in good hands going forward, and from where we started to, and the timeline and how we got here, So going forward, I'm quite confident that the group will make the right decisions and get us a right deal at the end of the day.
Thank you, Richard. Appreciate that. Now we can go to Dr. Lee's written summary.
I'm afraid that in terms of the meeting, my challenge is actually that I'm having a hard time getting the right view. Aha, okay, here we go. For the sake of the
You
Zoom
just kept
recording.
talking long enough, you would find it.
Exactly,
Yeah.
yes. So this is the business case summary for essentially to make sure that it's publicly posted and understood as part of the board meeting. The outline, I'll gloss through a lot of this because I think we've reviewed these things already. Ontario's system is unique because we have a strong local public health service delivery model. In a lot of other provinces is regional or provincial. And so I think that's one of the strengths of the local public health system, but it does mean that there are a number of health units. There have been a series of reports over the years from the province over a number of circumstances indicating a benefit or a proposal to reduce the number of health units. And that's part of the context here, as well that the province has talked about amalgamation plans in the past, most recently just pre-pandemic, which was paused during the pandemic. And now we're on the other side where the expectation on the part of the province is for health units to examine and explore mergers if their population is less than 500,000. This, I think, is review for people, but certainly is part of the context. The other piece is that when the province recently announced their strategy to strengthen public health, the voluntary merger piece is one of three prongs in their strategy. There's also a currently ongoing review of the Ontario Public Health Standards, which is the foundational documents for the role and scope of local public health units, as well as a planned but not yet undertaken review of the funding model of local public health. In terms of overview, and that was the context, we're now getting into some of the submissions for the business case, which will be submitted to the province on Tuesday, is the specific merger conversations that we've had locally. So the merger partnership that is being undertaken is these three health units, which I won't read because they are a mouthful. The new legal name that's being proposed is the Southeast Health Unit. And this map with the purple is indicating those three respective health units, which gives an idea of why it's called Southeast. In terms of the guiding principles, certainly in the conversations we've had among the three organizations that I just talked about, the focus has been on four elements. One is the sustainability of the organization in the long term. The second is the continued responsiveness to local needs, and especially the understanding of where rural and urban needs might be different. The next is a focus on people, both in terms of our residents and stakeholders in our communities, as well as our respective staff. And then the last is retaining that evidence-based focus in the work that we do. Our goals, so, we talked about the the guiding principles. The goals, one, and this has been an emphasis, is improving the services overall for the organization that we're part of. And the second is empowering that the organization should thrive, especially in the long term. And then I already talked about that local and rural focus. We have undertaken cross-board engagement in a structure called the Tri-Board Committee. A few things have been undertaken. So the feasibility assessment, for which we have the report, a set of delegations to obligated municipalities, which have occurred in the past few weeks, a discussion at the board, at that board or cross-board level about planning for governance and levy harmonization. And then the last is discussion about organizational design and leadership. And these discussions will certainly be ongoing. In terms of the provincial objectives, and this is where I wanted to spend a little bit more, these are the objectives outlined in the business case for the province. And so you'll see that the province has talked about optimizing population size and characteristics. And certainly a combined our health unit and HPE and PFLA would reach that threshold that the province has talked about of 500,000. The population would be 570,000 for the partnership we are about to undertake. And we have a number of commonalities among the communities that we're talking about. So one is that's mixed urban rural geography that I mentioned earlier, as well similar industries of agriculture, manufacturing, and tourism, and similar, though distinct, service needs and public health needs in our communities. The next is improving organizational performance. And we talked about the ability to pool resources and subspecialize within our organization. We talked as well about surge capacity for emergencies and emerging issues. We talked as well about larger recruitment pools for skilled and highly trained staff for the delivery of public health services. Next, about strengthening leadership structures. We talked about smaller spans of control and portfolios for the management team, the opportunity for improved and formal backup and succession planning, and the ability for robust HR functions to provide enhanced support for staff, especially as needed during a merger transition. Very similarly, I think I already covered the elements for objective number 4. So we'll move to objective number 5. Here we talked about hospitals in our region already collaborating, across health unit borders, and certainly sort of in northern and southern geographies as well. There are 4 Ontario Health teams in this region. LGL has 2, and each of the other health units have 1. And these Ontario Health teams do also work together, and the health units work with them quite directly. And then the last is school boards and educational institutions. Of note for the LGL region is that St. Lawrence College is both in our region as well as the KFLA region. And lastly, regarding engagement and alignment with community partners and priority populations. There is some variability in the specific community partners among the 3 regions, but common organizations and topics. So for example, each of us have youth-focused organizations that provide services for older adults, community health and well-being organizations, etc. So there will be continued engagement with those organizations. There's also, and I'll note as well, some variability in the Indigenous populations of these 3 regions, with Hastings Prince Edward serving Tyendinaga First Nations Reserve and LGL having the lowest proportion of Indigenous individuals in the 3 regions. There are discussions and plans for engaging with Indigenous populations and groups within our region on the merger discussions, as well as engaging with community partners and priority populations regarding the merger discussions as well. The last thing that I'll mention is around planning for implementation, as well as the risk assessment that we've undertaken. So I mentioned that there will continue to be cross-board collaboration and discussion at the operational level as well. There have been some meetings already, and these will continue as well. So the executive teams of the three organizations working together on what implementation for a potential merger might look like. And especially with a focus on some of those internal service delivery structures, which will need to be ready by the time a legal merger happens, much more quickly than perhaps some of the program delivery structures might need to be ready. Those ones, we might have 2-3 years to do that integration. There will need to be really extensive staff engagement in this process. Certainly in the design of key elements of the organization, which may range from internal to external service delivery, organizational structure and process, the tools we use, the training that people get, et cetera. And so that is something that's on our mind as well. And mentioned as well, engagement with partners and communities. The risk assessment, we have talked about this as well. One of the greatest risks really is inadequate funding or resourcing for the implementation of a merger. And this is part of the discussion with the province, and that's going to be critical. As well, it's important to recognize that our staff are still recovering from the strain put upon them during the emergency phase of the COVID-19 pandemic, and our organizations are still in active recovery from the pandemic response, and a merger is another major change and potential additional workload. As well, the Ontario Public Health Standards Review is happening at the same time, and so there's really even more emphasis on adequate resourcing and careful considerations by leadership of the organizations. The other thing that I'll mention, and this is really to close, is that there are going to be a number of technical and practical challenges from an operational perspective, and those are going to be important to both acknowledge now as well as to plan for and to mitigate or manage down the road. And we will be looking to both leadership of the organization as well as staff within the organization to identify and also collaborate on those elements. The last slide here really is a summary of some of the topics within the funding request to the province, as I mentioned, on the need for resourcing for a merger and integration. I won't go through them other than to say that the considerations are quite thorough, and we have thought about ways in which these specific considerations during the integration process also contributes or is relevant for the sustainability of the organization in the long term. So that's it. Thank you, everyone.
Thank you, Dr. Lee. Any questions or comments on that? A lot of some of the next steps. The business case will go in on Tuesday or sooner. The boards are we've scheduled a meeting for, I want to say April 12th, April 9th, 12th, good. In the event that all three boards have passed this motion, which we did, and we'll start to work on and hiring some people to do the actual planning and the work and supporting the next step. So any questions or comments left other than that? Yes,
This last question, this presentation, is that going to be distributed to the municipalities?
It will be public as
It'll be
part
public.
of our postings for the Board of Health. And so we'll certainly make that link available to, or send it to board members.
on that, that's a good point. Dr. Lee and I have talked about using one of those Friday webinars just for municipal on this topic alone and inviting all, not just the obligated, but all of them to give them an update on where we're at.
Our council meeting is on Tuesday.
Well, you'll have the press release tonight, which will say what's officially in there.
And
And,
I'll circulate these slides to
Thank
the
you.
board
Yeah.
members tonight.
and so sometime in April, we would plan to have a in-service just with municipalities and tell them where we're at and where we hope to go. It says April 18th. We're going ahead with that one. Our next board meeting. We have a bunch of,
We look,
Okay.
we look to Heather.
yes. So the next board meeting is April the 18th. Probably more normal agenda items. Location.
I think it would be hybrid as our usual.
Nothing else. I'll entertain a motion for adjournment.
It was moved by myself and seconded by Robin Jones that the meeting adjourn at 6. Yeah, because she's.
Seconded by Jane. All in favor? The motion is carried. The meeting is adjourned. Thank you.